Come in.
Hi there, I'm Emily. I'm going to be your nurse today. Can you tell me your name and date of birth?
Larry Jones.
Okay, and what's your birthday?
10/2/1951.
All right, Larry. So what I'm going to do is I'm going to go ahead and do a little assessment on you, and then we'll get into talking about why you're here, okay? Can you tell me where you are today?
Hospital.
You're at the hospital? All right, awesome. Do you have any pain in your upper extremities to start off?
I have pain in my stomach.
You have pain in your stomach? Okay. Are you having any gas with your pain in your stomach?
No.
No? And when was your last bowel movement?
4 days ago.
4 days ago? Okay. So I'm going to go ahead and have you turn your head to the left. All right, and you do have some JBD extension. Turn your head to the other side, and you have a little bit there as well. So a little bit about why you have some JBD is because of your diagnosis that you came in today, and you have some swelling and things like that, so it's causing you to have some fluid buildup. So I'm going to go ahead and listen to your lungs, okay, to listen to see if you have any crackles. All right, it does sound like you have some crackles in your lungs, so I'm going to go ahead and listen to your posterior. Go ahead and lean up for me if you can, if that's not too much pain. All right, go ahead and sit back. So a lot of the times when you have patients coming in that we see with congestive heart failure or anything that has to do with their heart, we can see some edema, some JVD extension, and we are also going to hear some crackles in your lungs, and that is present on you because of the fluid buildup that's happening in your system since you're not pumping all that blood out, okay? So I'm going to go ahead and look at your stomach. Is it tender or anything like that? Or is it just kind of painful?
Yeah.
Painful? Okay. So can you go ahead and tell me what your quality of your pain is?
7 out of 10.
7 out of 10. And what does it feel like?
It feels like...
Is it a dull, achy pain? It's an achy pain? Okay. And does anything help it by changing your position or anything like that?
Changing position.
Changing positions? Okay, and when did this happen?
It happened 4 days ago.
You saw it 4 days ago? Okay, so I'm going to go ahead and listen. All right, so I do hear some vowel sounds at all times 4, so that's a good thing. But you do have a little bit of distension and tenderness, so I'm just going to go ahead and palpate and let me know if that hurts, okay? So your stomach isn't hard, so that's a good sign, but you are getting a little bit from not being going to the bathroom, okay? And you don't have any type of bruising on your arms. Your skin is pink and warm. And your IV site is looking good. It's patent. Are you having any tenderness in your IV site?
No.
No? Okay. Your IV site is also, tubing is great. It's not tangled or anything like that. She can get up and walk to the bathroom with no issues. Everything is out of her way, so she'll be able to take her IV with her. She does not have a catheter on the side of her bed. If it would be on an immobile part of the bed. I'm going to go ahead and feel your legs to make sure everything's okay there, okay? Are you having any pain in your lower extremities?
No.
No? Okay, she does have a little bit of edema on her ankles, about a 1. She is going to have some good cap refill on her toes of less than 3 seconds. Can you go ahead and push for me? And go ahead and pull. All right, awesome. Do you have any questions for me right now?
No.
Okay, so I'm going to go ahead and get into your why you came in and just kind of go over what we did. So your vital signs are 150/72. Your heart rate was 102, and it kind of bounced between that and 123. Your heart rate was in between 24 and 32, and your temperature was 99.1. So you do have some elevation in your blood pressure, your heart rate, and your respirations. But you did have some complaints of shortness of breath when you came in as well. Have you been more tired lately?
Yes.
Yeah. You came in with some fatigue and shortness of breath and abdominal discomfort. You've had some previous heart conditions, so we wanted to go ahead and do a chest x-ray, EKG, and echocardiogram just to kind of look at all of that type of thing. Also, we want to look at your troponin levels, and you get a CBC on you to just make sure that your levels aren't too high, and kind of that if your troponin's high, it'll kind of show us what's actually going on. We also could want to check your kidney function, because with patients that have heart disease, sometimes most of the time, you're going to see a decreased urine output because your heart isn't pumping enough blood. So we also do not want to have any thing going on that route, okay? All right. So we also see that you've had some weight gain in the past 3 days, and we notice it a lot because of your fluid retention. So because you aren't urinating, you aren't throwing any of that waste out, it's going to cause some pulmonary edema and some crackles, which what we did here. Do you have any questions so far?
No.
Okay. So what we are going to do for you is going to have the doctor come in and talk to you about different medications that you possibly could be taking. So we might put you on some digoxin, and that's going to help with making sure that nothing gets worse, especially since you are having some heart failure. And it's going to also increase your heart pumping, so it's going to push more cardiac output out and helping to make sure that maybe your urine's going to come up and you're going to start having more normal functioning. We also might give you some furosemide. That's a diuretic, so it's going to help pull off some of that fluid that's on your body, but we also want to make sure that you're monitoring your potassium levels, because pulling all that water off can also pull off some of that potassium, and you could go into low potassium. It also has a good effect on your blood pressure. Since you do have hypertension, that furosemide is going to help lower that blood pressure as well. So some medications that might be ordered are going to be some beta blockers, ACE inhibitors, or angiotensin receptor blockers. So those might be metoprolol, lisinopril, losartan. You could be put on some digoxin. But other than that, do you have any questions for me since I went over your medications?
No.
No? All right. Well, I will go ahead and let you be, and I will be back in to check on you, okay?
Okay.